Welcome back to the deep dive. If you're building bespoke software for healthcare, you know that feeling, right? The thrill of innovation, creating solutions that can really change things. But with that power comes a pretty big responsibility, safeguarding sensitive data. Now, for those who joined us from Module 1 on HIPAA fundamentals, we laid the essential groundwork. Today, we're building right on top of that foundation with Module 2, core HIPAA rules demystified. Our mission, basically, is to cut through the noise, extract the really crucial bits about HIPAA's core rules, privacy, security, and breach notification. And we're looking at all this specifically from your perspective, what it means for software development and operations day to day.
Exactly. And it's important to mention this deep dive pulls directly from the HIPAA Compliance for Software Development Organizations course that's provided by Special Man Academy. And this isn't just like abstract theory. Special Man Academy is the learning hub of Special Man Global Solution. And Special Man Global Solution is actually a software development company itself, helping innovators like you. So the insights we're sharing, they're practical, they're industry specific. They come from people who really get the challenges you face.
Yeah, that's super important. So think of this as your shortcut. Not just to understanding, but really implementing HIPAA-compliant practices across your whole software development lifecycle. We'll dig into managing protected health information, PHI, securely, and how to build, sustainable compliance programs that tick the regulatory boxes and actually support your business goals. Okay, let's start unpacking the privacy rule. It often feels like the absolute bedrock for patient trust, doesn't it? All about giving people control over their own health info. But for us in software development, how does that actually translate? Like into tangible features, into processes? How do we build that trust right into the code?
That's really the fundamental question, isn't it? The privacy rule, at its core, ensures patients have significant control over their PHI. That means they have specific, actionable rights about how their information is accessed, used, and shared. And for any team-building healthcare software, understanding and, crucially, supporting these rights is just non-negotiable. Your platform has to empower patients. Think about the right to access their own records, electronically, paper form, whatever works for them. Your patient portals. They need to make this easy, seamless. Then there's the right to request amendment. If their info is wrong or incomplete, your system needs a way to handle that request properly. And this one's huge. The right to an accounting of disclosures. Patients can ask, hey, who saw my data, when, and why? This absolutely demands robust, granular audit trails. You've got to build those in from day one. These aren't just, legal terms. They're concrete feature requirements for your software.
Okay, so patients have all these rights. What does that mean then for needing their consent? When we're designing an app or a service, do we need to get permission for absolutely everything?
Good question. No, not for everything. Generally, explicit patient authorization, like a specific sign-off, isn't needed for what HIPAA calls treatment, payment, or healthcare operations. We usually just shorten that to TPO. Think of these as the routine, essential activities for providing care and getting paid for it. However, for anything outside that core TPO, maybe marketing a new wellness program or certain types of research, then yes, explicit written authorization is definitely required. So for instance, if a patient uses your portal to securely check their lab results, that's TPO. No extra consent needed. The platform just needs to deliver it securely. But let's say a third-party research app wants to access patient data for a study that's not directly related to their current treatment. Then that explicit written authorization, that specific permission is absolutely needed. It's all about knowing the difference between routine care operations and, other uses.
That makes sense. Okay, so here's something for you, our listener, to chew on. In what ways should your software platform actively empower patients to use these IPA rights? And maybe more importantly, what are the real risks you might face if those features are clunky or confusing or just poorly implemented? Think about the operational headaches, not just the compliance ones.
That ties in perfectly with the minimum necessary standard. This is such a foundational IPA principle. Basically, organizations should only access, disclose, or use the absolute minimum amount of PHI needed to get a specific job done. That's the rule. And this applies to all PHI, digital, paper, even spoken words, the main exceptions. Disclosing info to the patient themselves or when the law absolutely requires it. Now, for software development, this is really where architecture meets compliance head-on. When you're designing features, you have to rigorously ask what data fields are truly essential for this function. You need to limit user permissions. So, for example, a billing administrator sees demographic and service info, maybe dates of service, but definitely not the patient's detailed clinical history. This is where role-based access control, RBAC, becomes so critical. It literally prevents users from seeing data that's not relevant to their specific role. It also means your APIs, your data exports, they should be designed to only push out the absolute minimum data fields necessary for that receiving system or process.
Right, this is where it gets really interesting for our audience, I think. How does this minimum necessary idea actually guide our coding choices, our system architecture, down to the nitty-gritty?
Yeah, it's about designing for least privilege right from the start. Think about a developer working in a test environment, maybe a QA environment. Do they really need live, actual patient data? Almost certainly not. That's a huge risk, right? An unnecessary overexposure. Instead, you should be using de-identified data or maybe synthetic data whenever humanly possible in those non-production environments. Which brings up a really important point for discussion. How can that kind of overexposure of PHI during development or testing create serious compliance risks? And what specific controls would you put in place to stop that? It's a scenario lots of software teams grapple with. And remember, it's not just about the code itself. HIPAA applies to all parts of your business operations, whether you're a covered entity or a business associate, like many software vendors are. This means every single function, customer support, training, data storage, backups, even how you manage third-party integrations, every piece has to safeguard PHI rigorously. So you need solid data handling policies. Think secure transfer, storage, retrieval, and, importantly, disposal of PHI. Encryption, data masking, these are key tools. Vendor management is huge. You absolutely need business associate agreements, BAAs, signed with any third party that handles PHI on your behalf. Training isn't a one-and-done thing. All employees, technical or not, need ongoing HIPAA education. You also need clear incident response procedures, what happens when something goes wrong, and meticulous documentation of everything: data flows, user access, your policies, your training logs.
Wow, okay. So it really isn't just the dev team's responsibility then. It sounds like pretty much everyone in the company needs to be involved and aware, which leads to an interesting tension point, doesn't it? Organizations, especially in tech, are often trying to move fast, iterate quickly on products. How do you balance that speed with these really strict operational controls that HIPAA demands? Where's the sweet spot?
It's a constant balancing act, for sure. A classic example. Think about your customer support team. They absolutely must verify a caller's identity strictly before discussing any PHI. If they slip up, maybe get rushed, that's a potential operational exposure right there. So this makes you think, how can those everyday business operations inadvertently expose PHI? And what kind of practical checkpoints should you implement to mitigate those risks, especially when you're in a fast-paced development cycle?
Right. Okay, so talk privacy, what data can be used. Let's shift gears now to security, how that data is actually protected. This brings us squarely into the domain of the IPA security rule. And what's fascinating here, I think, is it's really comprehensive, sort of layered framework for protection.
Precisely. The security rule's core purpose, its whole reason for being, is to protect the confidentiality, integrity, and availability, the CIA triad of electronic protected health information, or EPHI. And it sets up 3 fundamental categories of safeguards you absolutely must implement. Think of it as defense in depth. Okay, first up, administrative safeguards. These are basically your organizational policies and procedures, the written rules, the processes you follow. Examples include conducting regular risk analyses. We'll come back to that, assigning a dedicated security official, workforce training, and really importantly, information access management. That's about limiting EPHI access just to those who truly need it for their job. Second, physical safeguards. This is about protecting the actual hardware, the devices, the locations where EPHI exists. So think facility access controls who can get into your server rooms or data centers, and workstation security, making sure laptops and desktops are secured, screens locked, that kind of thing. And third, technical safeguards. This is the technology itself and the policies governing its use that directly protect EPHI and control access. Key examples here are strong access control for systems like logins and passwords, audit controls that log and allow you to examine who did what when, and transmission security. That last one means EPHI must be encrypted when it's sent electronically over networks.
Okay. Administrative, physical, technical. Looking at those 3, which one tends to be the most challenging, do you think? Especially for software-focused companies like ours, maybe ones that are heavily cloud-based, trying to enforce consistently with rapid deployments?
That's a really sharp question. And often the answer circles back to the risk analysis fundamentals. Because this isn't just like a suggestion in the security rule. It's the absolute foundation. It's a required ongoing process. You have to proactively look for vulnerabilities and risks to your EPHI. The basic steps are pretty logical. First, you identify everywhere ePHI is stored, received, maintained, or transmitted within your systems and workflows. Then you catalog potential threats and vulnerabilities. Things like malware, ransomware, insider threats, lost devices, misconfigurations. Next, you evaluate the likelihood of each threat happening and the potential impact if it did. You then assess the security measures you already have in place. Are they effective? Based on that, you determine the level of risk: high, medium, low. Then, crucially, you implement measures to mitigate those high priority risks. And finally, you absolutely must document the entire analysis, your findings, your decisions, your actions, and you have to update it regularly. It's not a one-time thing, it's a continuous cycle. So for a development team, what might this look like? It could mean mapping out every single place PHI touches production databases, yes, but also backups, staging servers, maybe even developer laptops if you're not careful. You identify a threat, like maybe someone losing a laptop containing test data that wasn't properly de-identified, or a vulnerability, like using unencrypted USB drives to transfer files. The mitigation then becomes clear. Implement strict policies against storing PHI on local machines, maybe enforce mandatory full disk encryption, and ensure all data transfers happen only through secure, encrypted, and monitored channels, no exceptions.
That really highlights the ongoing nature. So this raises an important question then. How often should a software organization actually repeat its risk analysis? Is it just an annual thing? And maybe more importantly, what kind of events might trigger review outside that regular cycle, like a major system change or a new integration?
Definitely dynamic. And beyond just the analysis, you need really robust security incident procedures. The security rule mandates having clear, documented procedures for responding to any security incident that involves ePHI. The goal is quick containment, thorough investigation, effective mitigation, and, if needed, proper notification to minimize the damage. The key elements you need in your plan are identification: how do employees or your monitoring systems recognize and report a potential incident? Immediate response: what actions do you take right away to contain the issue, like disabling compromised accounts or isolating affected systems? Mitigation: what steps do you take to lessen the harm? Meticulous documentation, keeping detailed records of everything that happened and what you did. And then notification. If PHI was actually compromised, you need to notify affected individuals, HHS, maybe the media, following the breach notification rule, and finally a post-incident review. What went wrong? How can we prevent it next time? Learn from it. For example, if your intrusion detection system flags a potentially compromised user credential, the immediate response is suspend that account's access instantly, start analyzing server logs for suspicious activity, and log a detailed incident report right away.
Right. So what are the real-world consequences then for a software development company specifically if they don't have a well-tested, genuinely effective security incident response plan? I imagine it goes way beyond just potential fines, impacted reputation, and client trust too. Okay, so let's say despite all our best efforts with privacy and security safeguards, something goes wrong, an incident occurs. That's when the breach notification rule kicks in. This is where clarity and speed are just absolutely critical. What seems really key here is understanding that crucial difference between just any security incident and a reportable breach. They aren't necessarily the same thing, are they?
That distinction is fundamentally important. You're right. The HIPAA breach notification rule requires you to notify affected parties only when unsecured PHI, meaning PHI that wasn't encrypted or properly destroyed, has been accessed, acquired, used, or disclosed in a way that the privacy rule doesn't permit, and that access compromises the security or privacy of the PHI. So the key takeaway is, not every single security incident automatically qualifies as a reportable breach. To figure out if it is reportable, you have to perform a risk assessment. HIPAA gives you 4 factors to consider. 1, the nature and extent of the PHI involved. Was it highly sensitive data, like diagnoses or social security numbers? How much data was involved? 2, the persons who used or received the PHI. Was it potentially a malicious actor or maybe just an authorized employee who saw something they shouldn't have but didn't misuse it? 3, was the PHI actually acquired or viewed? Is there evidence data was actually read or taken, or was it just, say, exposed on a server for a short time with no evidence of access? And 4, the extent to which the risk was mitigated. Were you able to quickly secure the data, maybe destroy it, or get assurances it wouldn't be misused before any real harm occurred? And there are important exceptions, too. Situations that are generally not considered reportable breaches. For example, if an unauthorized employee accidentally accesses some PHI but they don't retain it, share it, or use it maliciously, and the access was limited, that might not be reportable after your risk assessment. Same if encrypted PHI gets out, but the encryption key itself wasn't compromised. The data is still secure. Think about this scenario. A developer accidentally emails a patient record to another internal colleague who is also authorized to see that patient's data for their work. If that error is caught quickly, the email is securely deleted and there's absolutely no evidence it went any further or was misused. That incident, while needing documentation internally, might not rise to the level of a reportable breach after you do the formal risk assessment. It was definitely an incident, but maybe not one requiring external notification.
Okay, that clarification is really helpful. So why is it so critical then for us as software developers and the companies we work for to be really clear on distinguishing between a general security incident and that specific category of a reportable breach? What are the potential pitfalls or risks if we get it wrong? Like, say, from over-reporting things that aren't breaches, or potentially much worse, under-reporting actual breaches.
Both scenarios have significant negative consequences, absolutely. Overreporting can cause unnecessary alarm and cost, while underreporting leads to regulatory penalties and loss of trust, which leads us directly into the specifics of notification timelines and procedures. Once you do determine, through that risk assessment, that a reportable breach has occurred, HIPAA lays out very strict requirements. It dictates exactly who you must notify, what information needs to be included in that notification, how quickly you have to do it. There's not much wiggle room. There are generally three main groups you need to think about notifying. First, the individuals whose PHI was compromised. They must be notified without unreasonable delay and absolutely no later than 60 days after you discovered the breach. This notification has to be in writing, usually first-class mail or email if they've agreed to it. Second, the U.S. Department of Health and Human Services, HHS, specifically the Office for Civil Rights, OCR. Now, the timing here depends on the size of the breach. If it involves 500 or more individuals, you have to notify HHS at the same time you notify the individual, so within that 60-day window. But if the breach affects fewer than 500 people, you still have to report it to HHS, but you can do it annually, within 60 days of the end of the calendar year in which the breach was discovered. And third, in some cases, the media. If a breach affects more than 500 residents of a single state or jurisdiction, you generally need to notify prominent media outlets serving that area. And your notification absolutely must include certain things: a description of what happened, the types of PHI involved, steps individuals should take to protect themselves, what your organization is doing in response, and contact information. Having pre-approved templates ready to go is really key for meeting those deadlines.
Okay, those timelines, especially the 60-day one, sound pretty tight, particularly if you're dealing with complex software systems where figuring out exactly what happened and who's affected might take time. What are some of the unique challenges a software development company might face in meeting these IPA notification timelines? And thinking ahead, how could things like automated logging or incident response systems potentially help ensure you meet those deadlines when the pressure's on?
That's a crucial point, especially looking forward. Automation can definitely help. And ultimately, all of this ties back into your overall mitigation strategies. Mitigation isn't just about cleaning up after a breach. It's about actively limiting the harm caused both to the people whose data was exposed and to your own organization's reputation and operations. And how well you mitigate can significantly influence how regulators like OCR view your overall compliance posture and maybe even the penalties involved. So, what are some key mitigation strategies? First, containment. As soon as you suspect a breach, your top priority is to stop the bleeding, isolate affected systems, close vulnerabilities, prevent any further PHI exposure. Then, investigation. You need to understand exactly how the breach occurred, what systems were involved, and precisely what data was accessed or potentially compromised. Next is remediation. This means fixing the underlying root cause, patching the software vulnerability, updating insecure procedures, maybe changing configurations. Then comes notification and support. Providing the required notifications, but also considering offering support like credit monitoring or identity theft protection services to affected individuals. And importantly, policy and training updates. Learn from the incident. Revise your security policies, update your procedures, retrain staff on the lessons learned, adjust your processes to prevent it happening again. And throughout all of this, meticulous documentation is absolutely essential. Record every action taken, every decision made, every finding from the investigation. So, for example, let's say a developer discovers a misconfigured cloud server accidentally exposed some PHI publicly. The mitigation steps would be: immediately restrict public access, analyze server logs to see if data was actually accessed, notify any potentially affected clients or individuals as required by the rule and your BAs, fix the configuration issue, and then, critically, retrain all engineers on secure cloud configuration management best practices.
It really does sound like a high-wire act sometimes. How can a company effectively balance that immediate need to act fast, to contain and mitigate a breach, with the equally important need for a really thorough investigation to ensure accurate reporting and effective remediation? It feels like you need both incredible speed and careful precision, almost simultaneously. So wrapping this all up, what does this deep dive into the privacy, security, and breach notification rules really mean for you, the innovative software professional listening today? I think if one thing is clear, it's that HIPAA compliance isn't just some technical checklist you complete once. It's really a cross-functional, ongoing commitment. It deeply impacts your technology choices, your business practices, and frankly, your entire company culture.
Absolutely. By proactively embedding these privacy and security principles, things like minimum necessary, role-based access, robust incident response, right into your systems and your daily operations from the very beginning. Your organization doesn't just meet the regulatory requirements, which is table stakes. You build something far more valuable in the long run, genuine user trust. And in healthcare technology, that trust is absolutely the bedrock of any successful innovation.
Which leaves us with a final thought for you to consider. As technology keeps evolving, think AI, IoT, cloud complexities, and new threats are constantly emerging. How can software development companies like yours continuously adapt their approach to HIPAA compliance? Not just to tick the boxes and meet the rules, but to truly become leaders in building trusted, secure, and innovative healthcare solutions. We really encourage you to reflect on how you might apply these core principles: privacy, security, breach notification to your own projects, your workflows, starting today and thinking long into the future.